Assalamu alaikum, and thank you for joining us for Men's Family Fitness Night. We are so excited to have all of you attend our parent session tonight. We hope that you find it informative and helpful. My name is Samaya, and I am a core French teacher with the DDSB. I'm also a member of MEND, the Muslim Network of Durham. On behalf of MEND, we would like to extend a very warm welcome to all of our participants and panelists in tonight's event. I will be beginning with a land acknowledgement put together by our board and the Indigenous community. The Durham District School Board acknowledges that many Indigenous nations have long-standing relationships, both historic and with the territories upon which our school board and schools are located. Today, this area is home to many Indigenous peoples from across Turtle Island. We acknowledge that the Durham region forms part of the traditional and treaty territories of the Mississaugas of Scugog Island First Nation, the Mississauga peoples, and the treaty territory of the Chippewas of Georgina Island First Nation. It is on these ancestral and treaty lands that we teach, learn, and live. We say this land acknowledgement before each of our events and in our schools in an effort to take the helpful towards reconciliation. I will now go on to introduce our first speaker. I am pleased to introduce our first panelist for this evening, Dr. Shabazz Jamal, who will be talking to us about how to keep your children safe and healthy during COVID, whether your child is attending in one of our school buildings or if they are attending virtually. I hope that you find this session to be very helpful.
Can you hear me?
Yeah.
I'm going to assume this is the part I start. Thank you for that introduction. Good evening, everyone. My name is Dr. Shabaz Jamal. I am a family physician, as she has already mentioned. My office is located in the Scarborough area, and my practice involves taking care of patients of all ages, young and old. COVID has become a part of my everyday, from discussing with families and diagnosing if needed. I will preface this talk by saying my kids are still awake, so if you hear banging on the door, it's probably them, so I apologize. We'll try to take care of that if needed, okay? When I was asked to do this talk on COVID safety for parents and their children, I thought it was a great idea. And I believe it's very important in this day and age for everybody to be educated on what's going on. I will say, though, we are learning new things about COVID almost every single day, and things that we believed were true before may not still be true today. It is an evolving process, but I'm hopeful that you can take a few things from what I say today that will help keep you and your kids, your families, and our communities safer. I do want to start very briefly by touching on what COVID is and what we know so far as to how people are getting sick. So everyone's heard COVID-19, it's the name of the actual disease, and it's caused by that very particular coronavirus that we were introduced at the beginning of the year. More important than that is how it spreads. So COVID-19 spreads the same way as the cold or the flu. As I tell all of my patients who inquire about it, all the common colds and all the flu viruses and everything that was here before those COVID years, they're still here. COVID is just an additional problem we have to deal with now. They look very similar and they can spread the same ways. When people talk, laugh, sing, cough, or sneeze, these tiny drops of liquid go into the air and land on surfaces. And if a person has COVID-19, the virus itself can be in those drops and it can spread to other people. The thing to note is there are people who have COVID but don't actually show signs of it, and these people can still spread the virus. You can get infected if you have interaction with those viral droplets. This can happen if you spend time with someone who's infected, if you touch your mouth, nose, eyes after touching something that had the tiny droplets land on it, if you share dishes, forks, spoons, water bottles, drink containers, or with someone who is sick. These are just some general everyday tips for everyone to hopefully use so that you can prevent the spread of COVID-19 and keep yourself and others healthy. Please, 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 please stay home and stay away from others if you're sick. The terms social distancing and self-isolation have become a part of our everyday vocabulary, but it's for good reason. Wash your hands very often as you can with soap and water for at least 20 seconds. You want to scrub the front and the back of each hand and between fingers. Everybody knows the happy birthday song. Even my 2-year-old knows it. Sing it to yourself, hum it to yourself if you have to while you're doing it. And it's a good gauge, and you do it twice over, and that's a good gauge to about 20 seconds. If there's no soap and water around, hand sanitizer works fine as well. If you cough and sneeze, please do it into an elbow or into a tissue. and then put the tissue in the garbage right away and wash your hands. And you want to keep at least 2 meters away from anyone who you don't live with. Now, lastly, on COVID, what happens if you get sick? Again, there are a lot of people who can get COVID and don't have any symptoms or don't feel very sick and can get better without a visit to the doctor or hospital. And if you do get it and you show symptoms, you may feel like you have a common cold or the flu. You might have a fever, a cough, a hard time breathing. It's kind of specific more to COVID as, a loss of taste or smell. Some people may not look or feel sick at all when they have the virus, but the problem is they can still spread it, as I mentioned earlier. It can take up to 14 days to show signs of COVID after being exposed to it from somebody who was sick. You need to be careful if you're sick, even if you're not, even if you're healthy in general and you don't really feel sick, you could give it to someone who will get very sick, like older people or those who have already had health problems. And if they get sick, they may need to stay in the hospital. So it is important for all of us to work together to prevent the spread of COVID. This will be the time where I do a little plug on the flu. Everybody knows the flu, and you talk to doctors, and I tell my patients about the flu shot. It's important. The flu is caused by a different virus. It's called the influenza virus or the flu virus. And while it's not entirely possible to say with certainty what will happen in the upcoming fall and winter months, it is the belief of many, myself included, that the flu virus and the coronavirus that caused COVID-19 will both be spreading in the months ahead. In this context, getting a flu vaccine will be more important than ever. And it is a recommendation that all people 6 months of age and older get the yearly flu vaccine. It is already currently available at some pharmacies, but your child's family physician or pediatrician should be able to administer it as well. Please consider it this year. The most common thing I hear from people is, I never get sick, I don't need it. Please speak with their physicians and your doctors to see if it is right for you. Getting a flu vaccine will not protect against COVID-19. However, flu vaccination has many other important benefits. The flu can cause people to get sick. People can get very sick and need to be in the hospital for days. And ultimately, I have seen people die from the flu. The flu vaccines have been shown to reduce the risk of the flu illness, to reduce the risk of hospitalizations, and ultimately reduce the chance of dying. So if we can keep people out of the hospital with the flu by administering a simple vaccine, it'll help us take better care of everyone and give resources in the hospital to those who have other needs, such as COVID. So this is where I'll turn to more of the parent-specific talk. So how can parents help keep their children safe during this pandemic? As Sumaya mentioned, we have parents who have children that are going into the actual school buildings, and we have some children who are learning from home. For those who are going to school, there are ways that we can help keep your kids safe. First and foremost, as mentioned above, if your kid is sick, if your child is sick, do not send them to school. The Ontario government has sent out a new recommendation regarding symptoms and what to do if your child has certain symptoms. Please search for it online and become familiar with it. Print a copy and keep it in case you need it. And if at any point you have any concerns or want to be sure, please contact their doctor. Most, if not all, physicians are doing virtual care, telemedicine, so you can call in and within the same day you should be able to talk to them. And we should be able to help guide you with what the next step should be. Are you able to go to school within 24 hours? Do you need to get the COVID testing or not? Your children should be wearing masks at school. One way to help kids get comfortable with it is to normalize it for them. Make sure everyone in your household wears a mask. When you go out to public, when you're around other people you don't live with, going to the grocery store, the mall, at those times, ensure your child wears their mask correctly and safely so that when they are at school, they have been taught the proper ways to wear it, and they should have access to multiple masks in case they need more than one. Put their names on their mask with permanent markers. When I was growing up, there were things like Pogs and toys and stuff like that. We used to switch it and trade them. Please help your kids not to do that. So if you put their names with permanent marker on it, they're less likely to do that. For older kids, you want to pack a bottle of hand sanitizer with them and encourage them to wash their hands or use hand sanitizer before they eat their lunch. You want to get your kids to be comfortable using hand sanitizer, but for those kids who have very bad skin, their skin conditions, eczema, and it can irritate them, they can wear gloves. There was a study done that said you can wash those gloves and clean them with sanitizer for up to 20 times and the gloves are still good. It'll save their skin that might be affected by the hand sanitizer, and it still does have some sort of protection from touching COVID and stuff. Know your school's plan if there are COVID-19 cases, possible cases, or exposures to the virus in the school. Be ready in case the school turns to remote learning, where students have to be at home and do assignments from home and learn from home. Being prepared can help make the change easier if it does happen. Work with school staff if your child needs help getting a device or internet access. Before each school day, give yourself extra time to do a symptoms check before they head to school, and know the person in the school, the contact you need to call excuse me, in case the child needs to stay at home. And you want to keep the new masks at the door so you're not scrambling, you don't forget it. A common question I get, one of the most common things actually, is what to do when the children come home from school. So here's the tricky part. So coronavirus can live on some surfaces for a little while. We're still learning about this, even though it's been about 9-ish months since we've known about it. There are researchers that say they can live on surfaces for 3 hours, depending on the surface, 6 hours, up to a day, some for 30 minutes. So there's still a lot we don't know. We do know that the viruses and bacteria, but the coronavirus in particular, can end up on the floor in those droplets, as I spoke of. So shoes and the bottom of their bags that they place on the floor could transmit viruses and carry them back to your home. They should take their shoes off and leave them by the door. Your children and teens should not be running around your whole house with those shoes on that they went to school with, and they would be able to track the virus around your whole house if they do that. So taking their shoes off at the door is probably the best option. Also, backpacks should never be put on tables or beds, because now you've elevated the virus from the floor up to something you might touch with your hands, or if you put it on your bed, your head might lie down next to it and you might start breathing in the virus that way. Consider getting washable backpacks. Those droplets with viruses could be on the backpack as well, and those washable ones you can throw right into the washer and dryer. So things that are on the floor should stay on the floor. And if you happen to touch the bottom of the bag, just wash your hands before you touch your face so you don't contaminate yourself. And then finally, maybe changing out of their school clothes, and maybe even a quick shower to wash out their hair, and that way all the virus is gone. Most doctors and nurses and healthcare workers do that. We decontaminate when we get home, but mind you, we're in front of that virus all day long. Whereas in the case for your children who come from school, you don't know how much your child is actually being exposed. Your best bet, if you want to be very ultra conservative, would be to change on their arrival home and maybe even take a shower, but for sure, wash their hands. I can't emphasize that enough. If you don't want to go to the lengths of changing their clothes and having them shower, they should wash their hands when they come into the house. This is one of the most important things they should do. If they have washable masks, those cotton masks, choose a specific dirty laundry spot or put them into the washer and then wash them. If they have disposable masks, you can throw them out. But if the disposable masks want to be reused, you can put them in a paper bag for ventilation for a few days before they rewear them. And as I mentioned, as we don't know how long, but viruses can live on objects for a long time, we should get in the habit of cleaning and disinfecting those things, high touch surface areas frequently, such as doorknobs and light switches when people are there. So for kids that are learning from home, one of the major sticking points has been the issue of screen time. So both adults and children, because even adults are working from home more now, and children, from school, they're experiencing an increase in screen time. But just know it'll be okay. In fact, there's very little evidence directly connecting screen time and the amount of screen time to harm in kids. There was a recent research that was actually shown that demonstrated that children and screen time relations is not really that much. So the impact of screen time on mental health and well-being is actually fairly small. Other factors such as parental support, family relationships, or adverse childhood experiences are more impactful than screen time. So they can have as much or as little screen time as they have, but if they don't have the parental support or if they have adverse experiences in childhood, that's going to negatively affect them more than just having a couple extra hours of screen time. The bigger problem for screen time lies in the screens replacing the positive activities like exercise, socializing, and sleep. Here are some of the simple things to keep in mind. Try to have at least one meal per day without screens. Screen time and even background television during meals has been linked to eating junk food and increased weight in children. And the ads for foods and low nutrition options can influence what your children want to eat. Conversations during mealtime can help to shape a child's social emotional health and ease stress for the whole family. It is important to have screen-free hours before bed. Setting screens aside for 2 hours before bedtime makes it easier to fall asleep and wake up on time. The blue light that's emanated from the TVs and other screens does disrupt the natural sleep cycle. And for younger children, it also helps, it also helps to save the screens after nap time as a reward. Even for my son, I say if you take a nap, you can wake up and watch YouTube for a little bit. For older kids, their device alerts, cell phones, notifications, it can be an issue as well for them going to sleep or for them being woken up at nighttime. So try using a real alarm clock and keeping their phones out of their bedrooms. Give breaks in between learning if possible. Have them learn to step away from the screen, and it helps to keep moving both physically and mentally, and you might find that your children can get more done when they get back to the screen. Studies show that a simple walk, maybe even outside, for just even 5 minutes can help improve their mood and self-esteem, which can help productivity. For kids, teenagers, and their families, managing a healthy digital life can be a little complicated nowadays. Younger people are merging their online and offline lives with even less boundaries and sharing, commenting on everything in the process. Cyberbullying is a big issue. What social media has done nowadays to have children feel inadequate or having that isolation, it does endanger many youth. But the way we can get around this is spending more time with our kids off our own phones, and we can guide them to what actual healthy self-expression looks like. It's not just about limiting their exposure, but also to help guide them to how to use their digital spaces. Being present in their lives, especially around when they are in the digital space, is very important. Another thing that generally comes up with homeschooling is the lack of social interaction. Social connections are very important, and I'm sure the next speaker will touch on this too. You should continue to encourage your child or youth to stay social with their friends and peers. This will help them feel more connected by the time they eventually get back to school, whenever that is. Ideally, this involves face-to-face connections outside, as per COVID-19 physical guidelines. But if they can't meet face-to-face, try a video call, or go very old school and write a letter. But it's pretty outdated, actually. Routines are very important for children as well, especially for those kids who've lost their normal school day routine. Establishing new routines at home, such as a wake-up time and a bedtime, setting a screen curfew downtime, at which point there are no screens, meal times, they all should be routine as well. Kids love routines, and having a consistent and predictable routine is calming to them, and it can help them focus their attention on what is expected. Routines can help parents feel better as well. For parents working from home, be clear about limits that will be set when you are in your working hours. Establish a plan for what your children should be doing when you are working. For example, having a quiet time with a book or soft music, going to a safe place within the home, or playing with a special box of toys or activities you've put together for them. I can't stress this enough, but parents, take care of yourself so you can better take care of them. During each day, you may find that there's little time to focus on yourself. Consider scheduling quiet time into each day so you can have a few moments to exercise, get in touch with those you love, or just relax. Self-care is not selfish. It's how you can keep yourself grounded so that you're physically, mentally, and emotionally capable of being there for your young children. Pay attention to how you're feeling, and don't hesitate to pause and reflect before responding to your child's needs. It helps children feel safe and secure when they can see that you are calm. The last thing I will touch on about what I was asked about is how to boost your child's immunity, with the hopes that maybe it'll help protect against COVID. So it is shown that research shows that quality sleep is essential when it comes to health for both children and adults, and ensuring that you and your child gets an adequate amount of quality sleep can help boost your immune system and keep your families healthy. This is a high priority during COVID-19, but also year-round. There should be something that is stress at home. A child's poor sleep, if they're not sleeping well, can be due to many issues. If there's lack of stimulation during the day, both physically and mentally. If there's increased screen time with TVs, computers, or video games, that have a hard time going to sleep, like I mentioned earlier. And the increased feelings of stress and anxiety at home. So if your child is consistently not getting enough sleep, they are 3 times more likely to get sick. The question about vitamins also comes up. So there's currently no proof that vitamins can help against COVID. There are some studies that show that people with low vitamin D levels may be at higher risk for COVID, but nothing has been proven yet. I still tell all of my patients and families to take vitamin D daily. Speak to yours and your children's doctors to see if vitamin D or multivitamins are the right thing for you. But there are just some general immune strengthening strategies that I will talk about. Exercising regularly. Experts recommend about 150 minutes of moderate exercise per week to help strengthen the immune system. Eating a healthy, balanced diet that is high in fruits and vegetables, maintaining a healthy weight, reducing stress and developing good coping mechanisms, including activities in your daily life that helps you handle stress, virtually connecting with loved ones, going outside, practicing meditation, exercising, making art or other hobbies, things that will help you personally reduce stress, and find ways that will help reduce your children's stress as well. Quitting smoking. If you smoke, stop. It's that simple. It's not that simple, but it's easy to say. It's easier said than done, but it's one of those things that we know it will help. And again, there are ways that your physicians, doctors can help you if you need the help to quit smoking. And taking steps to prevent infection, like washing your hands frequently, social distancing, which you've seen, I've mentioned almost a million times in the past, 15 minutes. Wash your hands, one of the easiest things that we can do. And social distance, wearing masks is one of the best things that we can do in this specific COVID time. I think that's all that I have for you today. I hope you've either learned something new that you can use, or that you've had some knowledge in the past that was reinforced by what I said. I do appreciate all of you listening to my talk. Stay safe, everyone, and I hope you have a good night. I think that's it.
Thank you, Shabazz.
Perfect.
I am just going to replace you in the spotlight. Thank you, Dr. Jamal, for all those important tips and information on how we can keep our kids safe during these uncertain times. We appreciate you sharing your expertise and knowledge with us, and we hope that we are all able to do our part in flattening the curve and, of course, keeping our families safe. I'm going to go ahead and introduce our next panelist. Our next panelist is Attique from Nasiha. We are thrilled that he is able to join us and that Nasiha came on board for this event. He is going to be joining us to give us some perspective on how to check in on our children in terms of their mental health. I'm going to do a brief intro for Mohsan. Mohsan Attique is a registered social worker and has helped families and their children manage home environments for the past 11 years with the Children Aid Society of Toronto. In addition to this full-time role, he serves as a Caring Dads facilitator and trainer worldwide. He also practices psychotherapy, offering services tailored to individuals, families, and couples across the GTA within the Muslim community. He has been part of the mental health and education outreach team since 2019. I'm going to go ahead and hand it over to Mohsan. Thank you so much for being here with us today.
Of course, my pleasure. Assalamu alaikum, everyone. I'm going to be following behind Shabazz, Dr. Shabazz. So he made some very, very important points and highlighted some very important tips for all the participants in terms of how to just stay safe in these trying times. So for me, really what I want to try to highlight for everyone today is the emphasis of how to stay grounded in these challenging and unprecedented times from a mental health perspective. So I think the first thing when it comes to your children and being aware of how to highlight or just be cognizant of what their needs are is to be informed. So I know that there's a lot of shifts constantly happening with the school boards all over the city and the province. The more information that we have as parents, the more equipped we are to be able to deal with any challenges that may present themselves. So the first thing would be to get a better understanding of what is the intended plan and or the shifting in plans for online schooling or in person. So once we can truly understand that or be more aware of for where our child may be, that way we will be able to kind of support them with that need. So that would be the first point of just kind of being aware. The next piece I would say is how do we kind of safeguard the ongoing need of safety of our children, both mentally, physically, in these trying times. So I think an important point to keep in mind here is conversation, communication. So a lot of times what I continue to see in these very trying times is people have this tendency that because we're spending so much time together at home, we can just kind of stay apart. So we'll text each other, we will, perhaps come together in passing over a meal or when we're ordering some food or whatever it may be, but there's no real concrete communication happening. And so that lack of communication causes a big divide. And when children don't get those needs met, they tend to lash out. And I'll spend a little more time near the end kind of going through what unmet needs really looks like for parents. And I think that would be the piece that kind of exemplifies this point. Also, the other point that I think is worth speaking to is how do we stay positive, supportive, and helpful towards our children if we have not necessarily figured it out for ourselves. And the way to kind of frame that is to look at the ever shifting nature of what is expected, what is not expected during these times of COVID and this pandemic. So one of the examples that I kind of give to families when they're trying to figure that out for themselves is, if it's not good enough for you, then it's probably not good enough for your child or any family member that you may be trying to support. And so what I mean by that is, if you think that you've reached out and your obligation is complete by sending that one text message, and you don't get a response, or say you get a very brief response, and you've checked it off as a to-do list task that's been completed, then you probably know that you need to do a little more. And so that I think that mental shift will allow for a lot more positive communication to take place between yourself and your children, and then you can naturally be able to make that progression in how you're parenting your child, and how you're keeping them safe, and how you're essentially being that support that you want to be, and or maybe be finding a struggle in doing. An example that comes to mind of this is a family that I'm currently working with, where, as I said, one of the primary issues that they're facing is the lack of communication. But the way it kind of manifests itself and presents itself isn't so much of the lack of communication, but more of acting out behaviors. And so the parents believe that they're doing their part by doing the check-in, how are you today? And if the kid says, don't talk to me, they'll try to engage them, and the kid shuts down, so they leave them alone. And they think that, I'm going to give them some time, and that time will allow them to recoup, and then we'll be able to have that conversation. But not knowing, they may be leaving them that space to be bullied. And so that's where you see that the online presence and the spending of time online and this virtual reality is having such a big toll on youngsters in this day and age. Especially, it's been that much more heightened in this time of COVID. So the essence there really, and the onus of that as a parent, is to do the check-in, right? And to be committed to the process, that through this opportunity of probing in a gentle manner, you get to find out a little more of where your child is, and that's applicable to any age group. So it doesn't, and of course it changes in how you communicate with them, but the overarching goal of making yourself be present, making yourself be known, does not shift. So I hope that's a tip that really kind of resonates with parents in terms of how to get to their level, and engage them in the manner that they necessarily need you in. Another point would be structured time at home. So what would that look like, especially in this with the shift of doing some schooling online and then being at home most of the time, or even if they're going out, the worries of what that looks like for every family is different. So one of the strategies that tends to help is to view structured time as a together family time, instead of leaving it open-ended to, my child has to do XYZ while I do my work, or whatever it may be. So so it could be at the start of the day, at the end of the day, just spending a quality time together, either to go through homework, again, as was mentioned, have dinner together, whatever the opportunity may be, whatever that time together looks like. It should be spent in a way where they're given an opportunity to have togetherness that draws from the family values and family connectedness. And so that, I think, would be something that could resonate to kind of bring together everyone that may be struggling especially from a mental health perspective, because we don't, again, we tend to minimize just that physical presence and that opportunity because we're so caught up in the unknown, right? Or in the day-to-day routine, the unknown of COVID and the day-to-day of trying to, be the best parent, bring home whatever our obligations and duties look like. The other piece for the school, of course, would be to maintain open lines of communication with the teachers and school principals and school staff, social workers, whoever is involved in our child's life in terms of supporting them, because that's key, right? As I've mentioned earlier, without open communication and open dialogue taking place, we tend to jump to conclusions, and those conclusions can lead us to down a spiral, a negative spiral, that can conclude with many different outcomes that we're not necessarily intending, but are the result of unhealthy or inappropriate or just lack of communication. So that's, I think, very important with the schools and being on top of that. Um, and then lastly, in terms of just the points would be becoming aware, if we're not already, of the platforms that our children are using to engage with their education currently in this time. So again, each school board has their own little spin of how they're going about it. A lot of the schools have given out laptops and have supported the technology piece. So again, it's important to become aware and be involved, get into the process. So if, again, if your child is, for example, 5 or any of those younger ages, they may not necessarily be spending that much time on, and it varies. There's a lot, some kids who are doing homeschooling, some who are spending more time doing the virtual piece as opposed to the in-person. So whatever the platform may be, the importance and the urgence is placed upon ensuring that you're well aware of what that platform looks like. So I think that's an important component of how to kind of become more mentally aware of what is going on, so that you can physically be able to contribute to your child's well-being. So what I wanted to spend a little bit of time just kind of highlighting, and I won't go into a lot of detail on it because it naturally will take a lot more time than what's allocated here. But I wanted to speak to the cycle of anxiety, and just wanted to kind of explain the circle of it, and then how we can kind of disrupt that, because a lot of people, young and old, are experiencing a lot of anxiety. And so generally speaking, the way the cycle looks is you have anxiety, which is something that's what we have a worry towards. So it could be not a fear, because that's physical. You have a immediate flight or fight kind of situation. Anxiety is more of a situation that perhaps you're worried about an exam for a kid, some friend, any array of future oriented event that would lead them to kind of go down a negative spiral of thinking. So what happens is you start there, you have the avoidance of that, whatever it may be, and then you have short-term relief. And then you end up with long-term anxiety, and the cycle is vicious and it continues. So the way to disrupt that, and I think this is very important, especially in this current time, is to be empathetic and to really kind of be open to understanding your own emotions around what's going on, and then applying the same sort of strategy towards your child. Because a lot of parents, what they tend to do is they shy away from engaging with their child, or they go to the extreme of becoming angry or whatever it may be when a child expresses emotion, right? Or they're feeling. So for example, a kid throws a tantrum. And I want you to kind of look at it as a volcano. So you have something that's underlying that anger, right? Anger is always the expressive emotion that comes out, but there's always something underneath. So if this child, a 5-year-old child, is throwing a tantrum, there's something else that's going on for this kid, and so that is an unmet need, right? And so as adults, we tend to have a lot of that as well. You see that in couples, right? So a couple is lacking again. And for a point of reference, there's the 5 languages of love, for those who are familiar with it. So there's something that's lacking, right, in one of those areas for couples, for example. And so they lash out because their need is not being met, and then it's being internalized in a negative way by the recipient of that lash out. And so the same thing applies for our children. If their need is not being met, just like how if our need is not being met in whatever shape or format in our reality, we tend to kind of want to seek that needs conclusion. And so if we become empathetic with ourselves and then with our children, we become more aware. And that's the second point, being self-aware. If we're becoming aware of where we are, where our emotions are, what's going on for us, we give ourselves the permission to be able to assess what truly is going on inside of us. What are our feelings, right, around whichever matter it may be. So it could be our it could be our spouses, it could be our children, it could be our work, whatever it may be. And again, in a time like this, COVID, it's got everyone functioning in a reality that's very different than what everyone is used to. And so our thoughts are jumping, right, and our dynamics at home are very different. Everything is chaotic, and there's a new form of living. And so we have to be very compassionate with ourselves when approaching our children, first and foremost our own selves and in our work dynamic, in our home environment, and then extending that same level of awareness, compassion, and empathy towards our children. I think the point of all of that I wanted to kind of wrap it up on is respect for the feelings and needs. And again, the example of this that I kind of give to parents is you have 2 siblings who are fighting, and so they fight, they get into each other, however, physically, emotionally, and then one of them cries and comes running to the parent. So what happens is the child who beats the other in expressing that frustration, either via tears, or blurting out whatever happened, they tend to be the one who kind of initiates that response. And so for a parent in that moment, especially if the day has been long and strenuous for us as parents, what we tend to do then is lash out, right, and try to deal with the immediate, which is the struggle of what's going on. And so what we have effectively done is we have not only taught our child that we deal with the immediate, but we've dismissed the underlying need of the child who perhaps is crying or the other child who perhaps lashed out. So again, it's that mental shift of just kind of becoming aware, right? Taking that second, slowing down to really become in tune with what we're thinking, what we're feeling, and what's truly going on around us, instead of being reactionary to what is being brought to us. So I hope that was helpful in terms of just hopefully, again, some new tips or some positive reinforcement of ideas that we've already been aware of. And I'll conclude there.
Thank you, Mohsan, for that amazing session. We appreciate your advice on staying grounded and keeping our mental health as well as that of our children in check. I hope that we are all able to help our children navigate their feelings during this very trying time for our little ones. I would also like to take a moment to thank the whole team at Nasiha who worked really, really hard to make this session happen today. We really appreciate that. That concludes our panelist portion of our session. I'm now going to hand the mic over to who's going to be speaking to us about really exciting upcoming events.
Assalamu alaikum, everybody, and thank you so much again for joining us. The good news is October is still, we're still here and still with us, and we have tons more events to share with you each Thursday of the month. So next week on Thursday, please, if you haven't already, there is still space and you can register at www.wearemend.ca. And next week on Thursday, our children's session will be with author Asma Hussein. She'll be doing a live reading of one of her books, followed by a Q&A session. And at 7:15 next Thursday, we will have a parent session with a panel of Black Muslim educators, students, and parents who will be discussing anti-Black racism and Islamophobia. Please check out our website for more details on other events. We still have our art event, which has space, as well as our STEM event, which is always a popular one that will end off the month. Please visit our website, register, and join us for more fun events. Thank you so much for your time. We appreciate it. Assalamu alaikum. Have a great night.